हेलो फ्रेंड्स, वेलकम टू मेडिकल साइंस एंड जीके यूट्यूब चैनल। आज की वीडियो में हम कुछ फार्मासिस्ट एग्ज़ाम्स के रिलेटेड क्वेश्चंस को डिस्कस करेंगे। सो मेक श्योर टू सब्सक्राइब माय चैनल और अगर वीडियो अच्छी लगे तो इसको शेयर करना ना भूलें। सो लेट्स स्टार्ट फ्रॉम द फर्स्ट क्वेश्चन। सो आवर फर्स्ट क्वेश्चन इज़ all of the following medications can be used in a pregnant woman with a peptic ulcer problem except one which is reserved for a refractory cases. So the medicine which is not used in pregnant women with peptic ulcer is omeprazole. Okay, now the second question is crystal urea is the side effect associated with. The answer is sulfonamide. Sulfonamide is a antibiotic drug that is used to treat bacterial infection. The meaning of crystal urea is presence of crystals in the urine. So it is a side effect of sulfonamide drug. So next question is, the Drugs and Cosmetic Act was passed in the year 1940. The answer is 1940. Okay, in the 1940 the Drug and Cosmetic Act was passed. If the question is about the rule, the Drug and Cosmetic rule, then answer will be 1945. Okay, but the act was passed in 1940. So answer is 1940. Next question is, which of the following is a female sex hormone? The female sex hormone is estrogen. Next is, chloroquine is the answer is 4-aminoquinoline. In the question we are talking about the classification. Okay, chloroquine is classified as a 4-aminoquinoline. Next is, in the pediatric dose calculation, children in the first 20 days of birth comes under the class of. So the first 20 days of the birth comes under neonatal. First 20 or 28 days. First 28 days of life of a child is known as neonatal period. Up to 1 year is known as infancy period. So first 28 days of a newborn is called as neonatal period or neonatal. Next is, a naturally occurring carminative is. Naturally occurring carminative means naturally present. The answer is asafoetida. Asafoetida is also known as hing. Okay, hing is a naturally occurring carminative. The next is the meaning of Latin term Rx. I think everyone knows about the term Rx. Rx means treatment. Okay, in this the answer is take two. Okay, next question is, what is the causative agent responsible for the disease aspergillosis? So the answer is fungus. Aspergillosis is a infection that is caused by fungus and mostly affect the respiratory system. Okay, this is a condition in which fungus attacks the respiratory system. Okay, the answer is fungus. Okay, next question is, all of the following diseases are classified as sexually transmitted disease except. So the answer is none of above. All three diseases are STDs. Chlamydia, gonorrhea and syphilis are the sexually transmitted disease. So answer is none of above. So next question is, copper intrauterine device in females will provide contraception for up to. The answer is up to 10 years. Intrauterine devices can provide contraception in females up to 10 years. Next is, the DPO Drug Price Control Order was exercised by central government in which year? 1995. Answer is 1995. Next is myocardium is a special muscle tissue found only in the heart. So myocardium is a membrane or layer that is present in heart. Next is this schedule to which list of drugs to be sold on prescription only belongs to. So the list of drugs that be sold on prescription, the schedule is H. H schedule is the answer. Next is mannitol is. So what is the mannitol? Mannitol is a osmotic diuretics. Next is the formulations used for the dental hygiene are known as. The formula which is used for the dental hygiene is known as dentifrice. Dentifrice is the answer that is used for the dental hygiene. Next question is erythroblastosis fetalis rises due to the incompatibility in the. So first, what is the erythroblastosis fetalis? That is a blood disease, also known as hemolytic disease of the fetus and newborn, that is caused by the IgG antibody of the mother. So that is a blood disorder caused by the antibody of mother. Next is a parenteral anticoagulant drug is. Which drug is parenteral anticoagulant? The answer is heparin. Heparin and warfarin both are anticoagulant drug, but heparin can be given through IV. Warfarin is mostly given in the form of tablets. So heparin is the answer. Next is Drugs and Magic Remedies Act was passed in. So in which year the Drugs and Magic Remedies Act was passed? 1954. The answer is 1954. Next is a non-drug part added to formulation to aid dilution, stability, maintaining, taste, masking, etc. known as. In this question, we are talking about the non-drug part that provides flavor to a medicine or that provides taste to a medicine, that is called additive. So additive means to add something in the medicine to the medicine, okay, to provide a flavor or to maintain the stability of a medicine is known as additive. Next is tropane alkaloids can be identified by. Tropane alkaloids can be identified by which test? Vitally test. Vitally test is the answer that can be used to identify the tropane alkaloids. The next question is the powerhouse of the cell is. The answer is mitochondria. Mitochondria is the powerhouse of the cell. Next is which of the following is not a benzodiazepine? Which of the following is not a benzodiazepine? The answer is zolpidem. Zolpidem is a drug that doesn't come under the benzodiazepine drugs. So other three drugs comes under benzodiazepine and zolpidem is the answer. Which of the following is the natural emulsifying agent obtained from a vegetable source? The natural emulsifying agent that obtained from the vegetable is called starch. We obtain starch from the vegetables, that is emulsifying agent, natural emulsifying agent. Next is a chelating agent used in the case of poisoning is. Chelating agent mostly used in the case of poisoning of metals. If there is a metal poisoning, then we used chelating agent. The chelating agent is dimercaprol that is used in the case of metal poisoning. The next question is filter sheets made of cellulose are. The answer is membrane filter. Filter sheets means filter papers that are made of cellulose, okay, also known as membrane filter. Next is 1 fluid ounce is equal to 30 ml. 1 ounce is equal to 30 ml. Okay. The next is the plant drug which is oxytoxic. The plant drug is ergot. Ergot is a plant drug that is oxytoxic. Oxytoxic is a drug that we used during labor for the uterine contractions. So, oxytocin is the ergot derived drug that is obtained from the plant. Next question is the diagnostic agent used for the functioning of thyroid gland. Thyroid gland, which of the following agent means which of the following agent is used to test the thyroid gland? That is iodine 131, that is iodine 131. Okay. Next is the constituent of cholesterol termed as bad cholesterol is, which of the following is known as the bad cholesterol? LDL, low density lipoprotein. LDL is low density lipoprotein. LDL is a bad cholesterol, HDL is a good cholesterol. So, the answer of this bad cholesterol is LDL. Next question is sterols belongs to the class of, sterols belongs to lipids. Lipids is the answer. Sterol belongs to the class of lipids. Next is hepatitis is a viral infection. So, hepatitis is an infection that caused by virus and transfer from one person to another. Next is a leukotriene receptor antagonist used in allergic cough is. Most widely used antagonist for allergic cough is montelukast. Montelukast is a widely used antagonist or medicine used in allergic cough and is also known as Monteir LC. So, the answer is montelukast. Next is the sulfonamide used for burn therapy is, answer is sulfadiazine. Sulfadiazine is the answer. So, this is a sulfonamide that is used as a medicine in the burn patient. Next question is a hypotonic solution can be made isotonic by the addition of hypotonic solution or isotonic solution. What is hypotonic? Hypotonic solution which has the concentration of solute is less, so that is hypotonic, and if the concentration is more or high, that is hypertonic. Sodium chloride in the hypotonic solution, it will become isotonic because the concentration of solution and solvent become same or equal. That is called isotonic solution. So, we will add sodium chloride in hypotonic solution and it becomes isotonic solution. So, the answer is sodium chloride. Next is the pathogenic organism in milk is killed by, the answer is pasteurization. The pathogenic organism in milk is killed by pasteurization. Next is agents promoting easy bowel evacuation is termed as laxatives. So, laxatives are the agents that promote bowel evacuation. So, answer is laxatives. Next is morphine, codeine and the thebaine are contained in opium. Opium is the answer. Morphine, codeine and thebaine naturally contained in opium. So we use morphine, codeine and thebaine as a sedative. Next is amantadine is a drug used as answer is antiviral, and amantadine is a drug that is used as a antiviral. Amantadine is also used in Parkinson disease and is also a antiviral drug that is used to treat infection. So answer is antiviral. Next is the antifungal drug fluconazole belongs to the class of fluconazole. The answer is azoles. Fluconazole belongs to the class of azoles. So answer is azole. Next question is the first Indian pharmacopoeia was published in 1955. So the answer is 1955. Next is ranitidine is a H2 antagonist. So ranitidine is a H2 antagonist. Ranitidine is widely used as a antacid. So next is creams are semi-solid emulsion of water and oil. So emulsion is the answer. Next is accusers are accusers means ocular means eye. So accusers are eye preparations. Accusers are used in any eye problem or eye disease as a eye preparations. So accusers are eye preparations. Next is eugenol is contained in answer is clove. Eugenol is contained in clove. So eugenol is a chemical and also known as clove oil. So eugenol is extracted from the clove, also known as clove oil. So answer is clove. Next is tuberculosis is diagnosed by which test is used to diagnose the tuberculosis? Answer is Mantoux test. Mantoux test is used to diagnose the tuberculosis. Next is one among the following is a communicable disease. Which of the following is a communicable disease? Answer is filariasis. Filariasis is a communicable disease. Filariasis spread from animal bite. So it's a parasitic disease that is caused by animal bite. It mostly affects lymph vessels or lymph system like lymph nodes. The other three ones, cancer, diabetes and hypertension, are non-communicable disease. Next is an example of sulfonyl urea is the answer is tolbutamide. Tolbutamide is a example of sulfonyl urea. Sulfonyl urea is a group of drugs used to treat type 2 diabetes. So tolbutamide is also treat type 2 diabetes. Tolbutamide is the answer. Next is blood plasma and blood serum preparations are dried by. Blood plasma and blood serum preparations that is stored for a long term are dried by freezer dryer. Next is the medicinal agents used for the increase in urine output is known as. The medicinal agent, the medicines that used to increase the urine output is known as diuretics. The answer is diuretics. Diuretics are used to increase the urine output.